I was asked to talk about pregnancy from an obstetrician's perspective. I'm going to try to coordinate two computers here, so sorry if I aren't keeping up. And I thought I might start by asking a question that I once asked, which is, what is an obstetrician anyway? This is sometimes how I think myself and my colleagues may be portrayed, as a little bit of a money-grubbing doctor that's more interested in making the golf round than giving you the birth experience that you really want. But I like to think we're a little bit more like this guy, who maybe not the man bag or the oversized teeth, but we like cuddling babies and we enjoy what we do, and we really like seeing happy couples. But what is an obstetrician? Well, we are doctors, a medical doctor who's undertaken specialist training in women's health and specifically in the management of women before, during and after pregnancy. We are experts in, I suppose, disease processes, high-risk pregnancy, complications when things go wrong. And we're trained to recognise problems and manage them appropriately. However, I would say that we're also skilled in low-risk pregnancy and delivery, and in fact, most of what myself and my colleagues do are look after healthy women who don't have any problems. So we are reasonably familiar with low-risk pregnancy. In the low-risk situation, our role is really to try to engage with parents and give them information that's unbiased, it's balanced, it's evidence-based, up-to-date, and help people make decisions about what they want for themselves and their pregnancy. In fact, I think one of the most important aspects of managing a low-risk pregnancy is the ability to be able to recognise when things aren't going the way we expected and there has been a deviation from normal and that maybe changes need to happen. I don't like using the word risk, but I suppose it's a medical word. Risk really refers to the chance of something happening that we don't want to happen. And unfortunately, no pregnancy is zero risk, but most women are healthy, their pregnancies are healthy, and we can honestly say that most women can expect a low-risk pregnancy. Unfortunately, we can't always predict the chance of something going wrong before pregnancy. We can't always even predict it during pregnancy. In fact, sometimes it's 3 a.m, halfway through a labour, when things suddenly become high risk. And that's when having somebody around that can recognise and deal with those risks can be useful. And I'm still not doing well. I should have gone the Madonna headset, shouldn't I? Yeah. And in that way, we're a little bit of a one-stop shop. I suppose you can keep seeing the same clinician through the whole pregnancy, regardless of what happens. So who am I? Well, I'm a father of 2 young boys who are no doubt terrorising their mother as I speak. I'm a husband of an exceedingly patient and lovely woman whose tolerance seems to know no bounds. I'm a natural-born public speaker. That's not really true. I'm very nervous. And I happen to be an obstetrician as well. What about my perspective on pregnancy? Well, like most of my colleagues, I view pregnancy as a normal, healthy state of womanhood. My perspective is to approach every woman's or every couple's pregnancy as a unique journey. Nobody's ever had your baby before. Nobody's ever been through your pregnancy before. No one can really know exactly what you're experiencing or tell you exactly what's going to happen to you. Even if you've had a baby before, your next pregnancy is not necessarily going to be the same. We don't expect every single child running around to be exactly the same, so we shouldn't expect all their pregnancies to be the same either. It's a highly personal time in our lives, having children, and I think it is an honour really to be chosen to help a couple look after their or be with them during their pregnancy and care for them. And I think we need to earn your respect, and hopefully my patients who see me feel that they can trust me and that I earn their respect with how I treat them. Being along the same lines of everything being unique, it is a moment in our lives that I think requires special attention, personalised attention, and certainly availability, because we each have different concerns about what might be going on. As a father and an obstetrician, one of my favourite moments is watching dads when they see their child for the first time, watching their hearts melt, even the biggest men, and the look on their face of newfound respect for their partner and what she has achieved. And that's something that I remember from when I became a father, and it's something I relive, fortunately, very frequently, and I can't imagine how anyone could get tired of reliving that. And yes, my job is to deal with complications. They don't always go the same way, but it is. I do feel it's important, or my perspective is to recognise that whilst birth is the culmination of pregnancy, and it is magical. It is also the beginning of parenthood, and I think we have babies because we want to be parents. And when birth doesn't necessarily go the way we want it to, I don't think it takes anything away from the achievement that a woman has had nurturing her baby for 9 months, nor does it detract from anybody's commitment to be the best possible parent they can. There's no right or wrong way to have a baby. There are options, there are possibilities, there are values, there are beliefs, there are ideals, and certainly one size does not fit all, and everybody needs to be treated differently. I'm trying to be cognizant of time here. So now that I've said that, I suppose I was asked to speak about a few things in particular. Preconception care, what goes on before you fall pregnant if you choose to see a doctor, how you might survive 9 months of pregnancy, and staying healthy in that time. So because pregnancy is a normal, healthy state of life, the aim really of pregnancy management is to maintain health, it's to keep you healthy. And preconception care and counselling is really about recognising that a woman's health before and during her pregnancy are of utmost importance in maintaining a healthy pregnancy and ending up with a healthy mum and baby at the end of it. In short, really, healthy pregnancy starts before you get pregnant. And really the simplest things you can do to maximise your pre-pregnancy health is to avoid smoking, avoid alcohol, and obviously avoid drugs. Exercising regularly is a great way to prepare your body for the physical demands of pregnancy and labour, as well as limiting pregnancy weight gain, which has some associated risks with that. And importantly, I think these changes are best made as a family. I think with the support of a husband or a partner and any other children that might be around, it's very hard for a woman to try to commit to eating healthy when the fridge is full of junk food that other people want to eat. And likewise, it's very hard to give up smoking when everyone around you is smoking. But I think when you make the decision to start a family, it's the ideal time to make the decision to start a healthy family and really make positive changes for the entire family at the same time. I think it's a good idea to make an appointment to discuss your plans for pregnancy with a GP or a trustworthy obstetrician if you happen to meet one today. And this is to have a pre-pregnancy checkup, which I'll go into very shortly. And lastly, if you are planning a pregnancy, it's always a good idea to start folate supplementation. Does anyone know what folate's all about or why we recommend? It's basically it's a vitamin. It's a B vitamin. And it's been shown in quite robust research data to reduce the risk of spina bifida and neural tube defects in all women, really, even low-risk women, which is why it's fortified in foods and recommended for everyone. It's very, very hard to, thank you, very, very hard to overdose on it. It's a vitamin, and it's essentially your kidneys will wee out any excess folate that you take. And what happens at a pre-pregnancy checkup? Well, essentially, it's a full review of your medical history, a full examination, and some boring doctor-type examinations that we do, blood tests and urine tests. And again, it's all about risk identification, risk management. If we know that if we can foresee that there may be a problem, then we can talk to you about maybe how we might deal with that and keep things as simple as possible rather than waiting until there's a big problem and needs drastic action. Also, your doctor or your obstetrician or GP may talk to you about general advice, as we mentioned, certain foods to avoid or minimize, optimizing your health, what sort of intensity or frequency you should exercise with, and what sort of precautions you should take. And if anybody has any specific questions about that, I'm happy to speak to them afterwards. Is there anything else? Definitely. Just couldn't fit it all on one slide. It's a good time for preventative medicine. Again, the idea being figuring out nipping things in the bud, basically. If you're due for a pap smear, or if you may fall due during your pregnancy, then a doctor may talk to you about having one then. Any vaccinations that may be useful during pregnancy or that we give after pregnancy can be given before. Anyone know what the big ones are? Usually we're screening for things like rubella, which you should be ideally immunised before pregnancy. We can't immunise you during pregnancy. Chicken pox, most people have had it. If not, there's an option for having a vaccination before pregnancy. And the other big one is whooping cough, which can either be boosted before pregnancy or safely given in pregnancy. And medical history and examinations about trying to manage any pre-existing health issues. Some people might have blood pressure, diabetes, things that can be optimized for pregnancy. And that often involves looking at medications that you might be on. it's always a good idea not to stop any medications until you've asked someone about it, because sometimes, an untreated condition can be worse for your pregnancy than the medication. But it is about talking about your medications. Some of them may not be necessary. Some of them may be necessary, but there might be pregnancy-safer alternatives. And sometimes that involves involving other specialists, depending on what the condition is, to really see if we can maximise health in pregnancy. And you probably say, I'm already pretty healthy, and that's true. Most women are pretty healthy. It makes the job very easy. But some women do require significant pre-pregnancy planning and medical optimization. And really that's what obstetric care is all about. That's what we do. It's about individualizing your pregnancy management, keeping healthy women healthy, and minimizing the risk for any women who might have health issues, so that we can really maximize healthy outcomes for all women and babies. And at the same time minimizing unnecessary treatments. Very quickly, how long will it take to fall pregnant? Not necessarily shortly after you stop birth control, but humans as a species are pretty lousy at falling pregnant, remarkably. But about 3 out of 5 couples will conceive within 6 months of trying. About another 1 in 6 it'll take a year, and the rest of us will really take a bit longer than a year. And that's not necessarily a sign of that there's a problem, but it is about a good idea to maybe speak to somebody about whether there is anything that can be done or looked at. And how will I survive 9 months? Geez, that's a good question. I would say learn about the changes in your body. Try to understand like any process that's going on, what's happening to you, and it can help you, or hopefully help you deal with some of the problems like morning sickness and skin changes. Stay active. That's a very good way to keep a pregnancy healthy. It's good for women's mood. It's good for their blood sugar. It's good for their blood pressure. It helps limit excess weight gain. It's really a great thing to do in pregnancy, and it can safely be done in pregnancy. Along those lines, do try to watch your weight, eat healthy. Hopefully your provider can give you good advice about eating healthy. The next two kind of go together. Don't set unrealistic expectations. You kind of see a lot in the media about exceedingly good pregnancy outcomes and mums, back on the catwalk the next week. And you also hear about the exceedingly bad outcomes a lot in the media. And really, as I say, there's a whole range in between, and most of us are somewhere in between. Thank you. But I think it pays to keep an open mind, become knowledgeable, ask questions, get different opinions, and really, try to be informed about what's out there and what we hope will happen and what may happen. Maintain communication with your partner. It's that goes for men and women. It's pregnancy and becoming parent really tips everything on its head. So it's pretty normal to be a bit apprehensive and trepidatious about that. So talking to each other about what you're going through is a good way to get through pregnancy together without any undetected problems. And do beware of war stories of well-meaning friends. Everyone likes to tell you about the time they were in labour for 3 weeks and gave birth to a horse, and just take it all with a grain of salt. As I said, nobody's been pregnant with your baby before, and nobody can really tell you what's going to happen. But people do like to talk. And dads, you probably want to know what to do too. Look, our role is really to be supportive. Be prepared to feel a little bit useless. That's how I felt. Guys, this really is not our domain. We can't have babies. We might want to be chivalrous and gallant, but at the end of the day, we can't have the contractions. We can't do this, go through the Caesar. We can't breastfeed. But we can do things. We can be supportive of the lifestyle changes that our partners are trying to make. We can attend classes to help show our support and learn also what's going on with them. Attend appointments if you can. Easier said than done. But communicate, and again, keeping those lines of communication open and letting her know that she's doing a wonderful job. And do spoil her rotten, because she's growing your child, and you will never repay that, ever. And even if you think you will, she'll do it again, hopefully. It's good for business if she does it again. So common problems or concerns: morning sickness. Sorry, it's horrible to watch. But some women find that there are simple ways around it, trying to identify particular foods or smells that they might be able to keep away from. There's some natural remedies: eating ginger, smelling mint, things like that. Meal plannings. Often women find waking up and eating something immediately before they get out of bed can help offset morning sickness developing later on. And if it comes to it, there are medications and very safe medications that your doctor could talk to you about. Sorry, guys, but this is where they pay us back with the snoring. Very common in pregnancy. You can't treat it. You sleep on your side. Try not to get too overweight, but really, they all snore. And we do it too, so we can't really complain. A lot of questions about sex. Can you have sex in pregnancy? Generally, the answer is yes. There are very few conditions where the answer is no. It's always worth just bouncing it off whoever's looking after you, because they will know. But the answer is almost always yes. And bleeding in early pregnancy. Bleeding is obviously very distressing when it happens. It happens about 1 in 10 pregnancies. Very common, really. Not automatically a sign that there's a problem, but anytime there's bleeding, it's worth being assessed by a doctor just so that we can tell you what's going on. Staying healthy, smoke-free household, regular exercise, healthy diet. I think we've already said that. And the last thing, a couple more. Stay hydrated, drink lots of water. Regular checkups with your trustworthy obstetrician. We'll monitor baby's growth, movements, and keep an eye on mum's symptoms and make sure she's staying healthy as well. Travel with caution. It's generally safe to travel, but you do have to consider things like where are you going, and if you have problems there, what are they going to do about it? If you're going to Sydney, that's probably okay. And travel insurance, you're not always covered for pregnancy, so that's one to be aware of, that if you happen to travel while you're pregnant and run into trouble, there may be a bill at the end of it that's worse than mine. Much worse. I barely have one. So staying healthy. Again, stress, anxiety, and low mood are very common in pregnancy. It's very normal to get a bit teary, a bit overwhelmed, a bit emotional. You don't even know why. But at the same time, about 10% of mums will get recognised depression in pregnancy, and it's something to be wary of. And certainly, if your symptoms are persistent or troubling, or you're having worrying thoughts, please speak to your partner, your friends, your doctor, obstetrician, midwife, somebody who can support you and help recognise when things are going wrong. I don't want to finish on that note. So lastly, I'd say enjoy your pregnancy. It's a wonderful time, and almost always it's a pleasure the most amazing experience to be involved in on a day-to-day basis. I'm a very lucky person. And the only other thing I'll say is that our Eve Health, we have a stand just over on F16. The girls have a couple other goodies if you like, and I've got various propaganda up here if you'd like to come and have a chat or ask some questions. And take a lot of photos, because they grow up and then all of a sudden you can't get a single photo that doesn't involve tongue poking. I've been trying for like 2 years. They all look like that. But thanks very much for listening, and enjoy the day, and I hope to see you soon.